I'm really honored that Craig's Cause would choose Tim and me to present. It's and just hats off to those people who are watching and connected with us right now. Tim and I have organized over 50 Skills for Healing Weekend retreats, and we know that the people who are the supporters, the family members, the loved ones, suffer as much stress and difficulty as the person who actually has the cancer diagnosis. And I'm just actually reading from this survey that Craig's Cause put together, and essentially they said 85% of people felt overwhelmed as the caregiver. 65% of them felt isolated. 93% were exhausted. Anxious, depressed, or irritable, that was 88%. So, I mean, those are even higher than the average numbers for many of the other cancers. But the bottom line is that it can be highly stressful to be that supporter. And so just, first of all, I want to just hats off to you all for participating. I think we really through the skills and knowledge, the attitude, you can actually improve your functioning and be a better supporter. And that's what we're hoping to accomplish here. I was wanting to show you the agenda for the day. So we're going to introduce ourselves, Tim and I. We'll practice a little bit of a relaxation visualization exercise, and then we would like to hear a little bit from even Kathleen, if they want to, around the difficulties being supporters. And we'll talk about the different roles that people are going to have as supporters. We'll have a break because it's hard to stare at a screen for too long. And then in the later part of the seminar, we'll work on some practical ways to work with stress and to be able to function and to be happier, healthier, and more effective, despite the incredible stresses that people who are the supporters for pancreatic survivors suffer. So we want to get some very practical sides on that side. And then we want to kind of walk away with one last encouragement of kind of opening up the communication between the person with a cancer diagnosis and their loved one. That's you, the supporter. So, and why that's extremely important in lots of different realms. So we're thinking probably 2 hours maximum today. So I've worked in the cancer field for over 25 years, and really through the support groups, the retreats, we know that people who have a cancer diagnosis, particularly pancreatic cancer diagnosis, have a few major goals, and they're pretty obvious. One is they want to maximize their chance of cure. And if that's not possible, then they want to maximize their longevity with fantastic quality of life. So it's been pretty obvious that people are going to go for that part of it. Secondly, and it's just pretty obvious as well, I mean, to get a cancer diagnosis or pancreatic cancer diagnosis can be incredibly stressful, and so many expectations are shattered in that moment. And so people want to be able to kind of come back home to feel more centered, more clear-minded, feeling more at peace. And so kind of settle down the emotional roller coaster is a major goal of people there. So it's pretty obvious you want to feel better emotionally. And then, the last one I kind of understand as well is that, in this, despite maybe recovering from a big surgery or, difficult chemotherapy, people want to have their body and their brain function better. They want to be able to, to enjoy their life maximally and to be able to do things that they love to do. So, I mean, it's pretty obvious that those are the goals there. And then lastly, I'd imagine it's pretty obvious as well that, the person with a cancer diagnosis doesn't want to see their loved ones suffer, right? So we don't want to cause our loved ones more stress. And I'm sorry to be kind of so blunt about this, but it really, in my mind, it's important just to be very clear about the goals and the kind of the reality as our starting point. And then the goals of the supporters are actually just basically the same thing, but it's from a slightly different perspective, right? So they're trying to maximize the kind of physical medicine, get the best for the loved ones, But the supporter, if they're going to be their best self, have to kind of settle down the emotional side. They want to be able to have their body, their minds work better. And obviously they don't want to see their loved ones, including the person with a cancer diagnosis, suffer. So in some senses, it's a similar journey, and yet we don't spend the time to kind of address that supporter's needs. So often I find myself, in the cancer clinic, and at the end of the consultation, I'll just turn my head 15 degrees and look to that support person and say, how are you really doing? And I just can't tell you the number of people that said to me, nobody's ever asked me that question. Nobody's kind of acknowledged that the support person has a lot of stress and a lot of responsibility and difficulty and so on. And so I just want to go to what I am hoping from this series of video conferences. Oops, before I go there, it's going to be I'm going to go over the what I call complete cancer care. So in order to get there is what I believe is the kind of integrative medicine picture, which is understanding. So your role as a supporter can be to help to understand and to facilitate that kind of treatment within the medical system. So that's one aspect of what you may do as a supporter. But then if a person has a diagnosis, they want to increase the strength within their body, right? So by doing the healthy activities, they want to help work with their brains, because our brains also are the medium which we experience the mind and emotions and so on. And lastly, it's this idea of nurturing something that's bigger than ourselves if you're so inclined. So that's the perspective that I take, is the best from the medical system along with the best that you can do in terms of body, mind, and spirit. Okay, so the goal for me within these conferences then is to help you be the best supporter that you can be. And we're not going to be perfect. This is a journey. It's difficult. This is not about just doing it right all the time. It's like, how do you work with your own human brain to function at this high level? So I'm just going to come back to it. So I just want to give you one more thing in terms of why we do some of the techniques that we do to help you. Your brain actually goes from two modes throughout the day. You're in one mode or the other mode. You're either in the kind of stressed, irritable, upset mode that doesn't think and perform very clearly, or you're in the kind of more wise, compassionate part of your brain. And as a supporter, you want to be in that kind of wise and compassionate part of your brain more often. And so these are the techniques that help you to do that, including petting your dog, including talking to other people and connecting with other people, and really kind of taking care of yourself. So it's a paradox. In order for you to be the best supporter of other people, you have to actually really take care of yourself. So I'm going to stop there just to I want to give you that context of, I want to empower you guys with the skills, knowledge, and attitude that can really help you be your best self. And to really suggest to you that you need to take care of yourself as a starting point. And I'm going to hand that over to Tim. Tim, do you want to offer kind of opening reflection?
Thank you, Rob. That's excellent. And, those statistics are very telling in terms of caregivers with family members with pancreatic cancer being so over the top in terms of stress and burnout and being tired and feeling frightened and so forth. So I think, it's a really important that they get the help that they need as well. And I think that's, this whole issue of self-care and being willing to take the time for yourself and self-compassion. So I think there's a whole inner journey there, because most of us have spent our lives focused on looking after everybody and everyone else. And then when our loved one gets cancer, we automatically go into that sort of default mechanism to be 100% on for them all the time. And, that just is not sustainable. So there's this kind of reflection and inner learning that we need to go through. And sometimes I would think of it as a sort of Well, at the beginning of our cancer programs, I talk about the fact that we have within the goodness of our human heart, we have this sort of deep wellspring of profound wisdom that we can draw on. And really, and it's a balancing of the head and the heart, you know. There's a lot of things that Rob's talking about. We have to think things through, but we also need to connect with our hearts to listen to what's good for us, which is also then good for our loved one, how to take care of ourselves. And when we listen to our heart and to our body's messages, we may not push ourselves to that point of burnout and the overdoing it. So I think of it as like allowing yourself to feel that you're a good enough caregiver fundamentally, unconditionally, you know, to trust in yourself rather than to feel like, oh, I have to do more, I have to do more, it's not good enough. And then when, you know, a medical emergency happens, there's a panic and, oh, I should have done this and I should have done that, and feeling guilty. I think that's one of the main messages that I would say is that, you know, guilt is never really helpful. I call it kind of a mind virus that was implanted in our culture, that you can feel remorse when you do something that's harmful and then make a vow not to do it again. And then you let go of that negative being hard on yourself. But I think a lot of people in our culture, when their loved one gets sick, they feel like, what did I do? Could I do something more? Oh, I haven't done enough. And there's this kind of constant putting too much pressure on yourself. So sure, you want to learn and do better. And I think you can do that when you have a clear head. And you can have a clear head by trusting in your innate wisdom and trusting in a deeper place of peace and confidence. And when you do that, you know, it's good enough. I'm good enough. I'm doing a good, rather than trying too hard, I'm good enough. And then there's this whole quality we'll talk more about towards the end in terms of communication, about allowing yourself to be vulnerable. Because of course, the person with the cancer diagnosis with pancreatic cancer is going through all kinds of stages of fear and denial and bargaining and all that difficult stages of dealing with grief. And likewise, we are too. You know, the caregivers is going through that same thing. And it's really important to be honest about that, and with yourself and with your loved ones, and have a friend that you can talk to. Because if we try to kind of hide our vulnerability, it's just that's not sustainable either. So, and then there's this piece about sort of, since pancreatic cancer has such a difficult kind of prognosis, that people get a lot of kind of bad news from the medical system, and that can really be a bummer. And how do you cope with that, you know? And I think that it's really learning to work with what we call anticipatory grief, that it's okay to grieve even before somebody dies, you know, and to grieve and to feel that sadness and to feel it together. You know, I can cry, you cry, we both cry together, that kind of thing. You know, and there's lots of natural stages that you go through when you're anticipating a loss. So there's some of the things that I was thinking about, and we want to learn to access this intelligence that we have. In order to do that, what Rob and I have been doing over many years with the Healing and Cancer Foundation is teaching people about mindfulness. And mindfulness is very simply being in the present moment, training yourself to come back to the present moment, and to learn that a lot of the thoughts that we have going through our minds, the worries, the anticipating the future, thinking about what I did wrong in the past, all that adds extra stress that's totally unnecessary. And if we can learn to bring ourselves more into the present, we can access that intelligence of the heart that knows what to do right now that's beneficial for my loved one and for myself. And so coming back into the present, we can be more skillful and more wise about what works and what doesn't work. And we're attentive to the stages that our loved one is going through, you know, because we really need to follow their lead. And so we need to pay attention to where they're at. And when we're going a million miles an hour in our head, it's really hard to pay attention to the other. So learning about mindfulness, how to settle one, and that deals with the whole issue of stress that we'll talk about more later. So mindfulness is paying attention. It's training the neuroplasticity of paying attention in the present moment. There's a lot of mindfulness research and meditation that shows that we can actually grow our brain and create these connections between the emotional brain and the stress brain and the human brain through simply just being quiet, tuning into our breath and our body, energizing our hearts and our compassion, and bringing that compassion to ourselves as well as to the other. So it really works. It's been shown through science that it's very effective. But a lot of people in our culture, we have such a culture that's based in entertainment, and we have our phones, we have our computers, we have our TVs, we have music playing all the time. There's this kind of, we're constantly distracting ourselves, especially if we're going through something that's grief or difficulty or fear. We have a tendency to want to escape what we're feeling. And the science of mindfulness says that the intelligence exists when we actually pay attention to the grief, to the sadness, to the fear, to whatever is difficult. We have the capacity as human beings to work that out if we're paying attention. But if we're distracting ourselves, we end up like little children. We're not really capable of accessing our true intelligence. And then we get caught in these kind of emotional loops and problems and so forth. So we wanted to begin today with a bit of setting the intention and doing a little bit of mindfulness. And so if I can guide people in that, we'll just start with a little meditation. So if you just notice where you're sitting and feel your bum in the seat and feel the sense of gravity, the sense of weight that your body has. And that in itself is what the scientists are calling introception. We're beginning to feel the inner experience. And that's where we begin to create neurological connections with the more primitive brain, emotional intelligence. So paying attention to the weight of your body and the gravity, the earth supports me. There's a kind of fundamental security in being conscious of the goodness of Mother Earth. Tuning into that, we're grounded, we're present. The next thing we use as an anchor for your mind in the present moment is the breath. And the breath represents your life. As long as you're breathing, you're alive. And I like to say sometimes mindfulness is the opposite of taking things for granted. Often we take our life for granted. We take all the good things for granted. So mindfulness is kind of like an awakened gratitude practice in every moment. I'm grateful that I'm on the earth, this good provider, Mother Earth, and I'm grateful that I'm alive and breathing. And as you settle into the body and paying attention to the breath, naturally, many thoughts begin to come up. Our mind has been busy for our whole life. And it is the nature of mind to give rise to thoughts, so that's not a problem. But when we notice that we're actually getting absorbed in our thoughts and we're losing contact with the body and the breath, that's the time to remind ourselves, wake up and come back to the breath and the body. The simplicity of being right here, right now. And on the out breath, you can allow yourself to let go. breathe out into the space and let your mind expand out as you breathe out. On the in-breath, there's a feeling of space. I'm opening up space to feel whatever it is that I'm feeling, whether it's fear, anger, hurt, paying attention. And when you get pulled into your thoughts, it's like getting lost in a dream. You wake up, come back to breath and body, which anchor you in the here and now. And from that ground of basic mindfulness, we can begin to practice loving kindness. We can begin to connect with our good human heart. So you might just put your hand over the center of your chest. And notice what's going on. It's an intelligence of the heart. It's very different. Sometimes first we experience that as a kind of vulnerability or tenderness. Our vulnerability is our awakened wisdom, our intelligence. So you could begin to feel as if you're breathing in and out through your heart center, in the middle of your chest, not the physical heart on the left side, but right in the middle of your chest. And if you like, you can put your hand back down, as if you're breathing in and out through your heart. If you like, you can close your eyes here. Feeling whatever it is that you feel, opening up a space for yourself to learn about yourself and to become your own best friend. Meditation is making friends with oneself and becoming intimate with oneself. And as you begin to feel that tenderness in your heart, you can begin to use the imagery that I like, is feeling that your heart is like the sun rising in the morning. And that sun represents unconditional love that is inherent to your nature. As you breathe out that warm sunlight is radiating out, and you can think of your family member, someone who's suffering perhaps with pancreatic cancer or something other than that. And imagine that you can send that sunlight from your heart into the heart of that other person, sending your natural unconditional love that's always there anyway. You're just paying attention to it, just bringing your mind to that which is already there. You see the face of your loved one, you maybe tune in a bit to their suffering, and you want them to feel better. You want them to feel relieved and at peace. You want them to conquer their fear and whatever it is that they're going through. So you send that prayer, that aspiration, may they be healed in the way that they need to be healed. And as you send that, it feels good. So we can smile a little bit. You can lift the corners of your mouth. You can, as if you're smiling in your heart, you smile in your eyes. Smile and send that warm sunlight into the person that you love. And as you do, you might see them it lifts a burden from their mind, from their shoulders. They begin to soften and have a moment of peace. And you keep sending that. And as you send it, you begin to realize that as I'm sending this to them, I'm also sending it to myself, down to your toes, down to your fingertips, to the crown of your head. Every cell of your body is being pervaded because this sunlight is going out in all directions. And that sunlight is as if to say, I love and accept myself just as I am, here and now in this very moment. As I give love to my loved one, I also permeate myself with loving kindness and self-compassion. And when you fill yourself with that, it naturally pours out of every hair pore. And we can think of all the people suffering with pancreatic cancer and their families. And we naturally radiate out, our little circle radiates out to others who are suffering. And as we breathe in, we courageously and fearlessly meet them where they are. And as we breathe out, we radiate that sunlight, that healing energy, that good intention. Just feel that with your breath for a few breaths. And remember, have a little smile, sending love. And then in that context of sending that love and shining like the sun, giving love to our loved one, to others, to ourselves, I invite you to set an intention for our webcast here today, what you want to learn and how you want to grow and transform. And beyond that, in your life, as a caregiver, as a family member, and in your life beyond that, your goals, your aspirations. Take a moment and in that radiant light of loving kindness, drop into your heart just maybe one sentence, one couple of words about your intention for yourself going forward. When we have a conscious intention, we're more likely to get there. So take a moment and set your intention in the heart. And that intention becomes like a pebble dropped into a pond. The waves of loving kindness and self-compassion radiate out. Naturally, you give that out to the universe. From there, we can relax our visualization. We can let go of any effort whatsoever. Relax your shoulders. Feel the earth beneath the weight of your body. And come back to the simplicity of each breath as you breathe it. When you're ready, you can gently open your eyes, looking out straight ahead, as if looking to the horizon. And with your out breath, relax and let go into that open space, opening yourself to that wider intelligence, that wider perspective. Thank you.
Mm,
Good start.
thank you. Um, Yeah, so many reflections after that wonderful visualization meditation. But I'm wondering if people want to just kind of stretch their legs or stretch their body. Maybe
Stand up.
you've been sitting for half an hour now, and whatever feels good for you. Be kind to yourself. Even rub your belly a little bit if you want to, or pet your dog if you have a dog close by. Yeah. Yeah. So thank you. Yeah, I mean, we spent some time doing that meditation, but people would have had a change in the brain waves. The part of their brain that is connected with making good choices and being clear-minded gets primed by practicing meditation. And I'm very high on people setting an intention. So being clear about how you want to be in this world. And I see that setting of intention first thing in the morning. Let me have patience, let me have kindness, let me be clear thinking, or going into a particular situation. Maybe you're going into a medical appointment. Let me understand my role here. Let me be clear. Let me ask good questions. And so again, you're focusing your intention on what you want to create. It's so practicing a meditation or relaxation, and then also setting your intention has a profound influence on your behavior, so you can feel better and be more effective. So both of those things are super important. So thanks, Tim, for bringing us back to the heart level, right? Why are we here? We're here to serve others. How do we serve others? We take care of ourselves as well. And that's, it's a foundation. It's a starting point for certain. We have a couple of people on the phone here, and what we wanted to do was to ask Eve and Kathleen if they want to share a little bit of their story of the diagnosis and what's been most difficult about being a supporter. And maybe I can just flash on the sharing on the screen so you can see the actual slide itself. So if you're willing to, what's been most difficult about being a supporter for someone with a pancreatic cancer diagnosis? So you can talk about, what's been difficult in the past or what you're struggling with right now, and what's your hope for these video conferences or this today. Do we have a brave volunteer amongst our two? Please, Eve, thanks.
I think what's been most difficult thus far with the diagnosis is dealing with how bleak the prognosis can be. For some context about the diagnosis that we went through in our story, my partner Dave and I have been together for almost 6 years. And in August, I would say, I guess earlier in the summer, he started having sort of bad back pain, like in a rib at the level of his liver. And we didn't really think anything of it. It was going away with the leave. It progressed to a point where in August, we thought maybe he was having some gallbladder issues. He went to the doctor. They did an ultrasound and found the liver mets. And then from there, it was sort of a whirlwind. He was officially diagnosed on October 10th after a biopsy and a CT scan. We tried to go into a clinical trial at Princess Margaret on November 1st. In the month between the two CT scans, his cancer progressed super aggressively. His largest liver mass went from being 5 or 6 centimeters to 15 in the span of months. So it was quite a progression, and they also found a pulmonary embolism. So it was just such a whirlwind and quite traumatic. I ended up taking a month off of work, and he started chemo on November 8th, and his results have been really remarkable. He started off with a CA19-9 of 300,000. And even after just the first chemo session, it was cut in half, more than half, really. It was 120,000 after the chemo. His liver masses are now back to 8 centimeters, so they've decreased in size by half. So things are going really well, but dealing with that prognosis and then also having hope based on how well he's doing. So just that's why I think the context there is important. We feel so hopeful given how dramatically he's responded to FOLFIRINOX, but then at the same time, just the real reality that the prognosis is so bleak has been the main difficulty. And what I'm hoping to get out of these conference groups is connecting with others who are going through the same thing, because while cancer can be quite a universal experience, I think something like pancreatic cancer and how aggressive it is a little bit unique, dealing with those kinds of really bleak prognoses. And yeah, so just connecting with others, getting some more tips on coping and, you know, navigating the medical system. And
yeah. Tactical and all. Thank you. Thanks for speaking from the heart as well. I mean, it sounds like, you know, from that initial, you know, real worrisome situation to the hope of the chemotherapy working really well. It's a bit of an emotional roller coaster, and thank God for you to reach out, right? This is really important that we share our experiences. So really thank you. I'm wondering if Kathleen, you're willing to share some of your story. I've forgotten whether you're gonna do that. Oh, good.
Yes. Hi.
Thank you.
Let's see here. So just a couple of things. The statistics that you quoted early on are really remarkable and incredible, and speak to the amount of overwhelming stress that caregivers in pancreatic cancer often silently suffer. In my opinion, just out of curiosity, how many people were, I guess, surveyed?
So yeah, we had every province and territory responded except for Nunavut, and we had, I believe it was 110 surveys that were completed. So we got every province and every territory except for Nunavut.
That's really incredible, that data. And that's where I tend to work during the daytime. So I work in surgical oncology research in the United States as a full-time job. And then I have a part-time job as a paramedic. And then I also lead a support group for pancreatic cancer patients. And so that's kind of why I wanted to join you guys, more or less just to get some tips and pointers and be sure the information that I cover is on par with, obviously, physicians and what they recommend for folks. From personal experience, my mom has pancreatic cancer, and I am her primary caregiver.
Yeah, take your time.
Excuse me.
It's all right.
It's okay to feel emotion.
Yeah, we encourage it, actually. So Kathy, maybe through the tears and you know, difficulty speaking, what's been most difficult about you know, being the primary caregiver for your mom who has pancreatic cancer?
I would say mostly for me anyway, there's a lot of isolation. I never had joined a support group at the time. Never sought counseling at the time. And so it's so strange to some degree to be on the other end of that now, because now she's doing very well, which is also like a different emotional roller coaster. But it's hard for me to hear other people and how that, you know, as a caregiver, how they struggle. And certainly I understand all those feelings, and a lot of that registers very deep with my own experience. But on the other end of those things, she does so well. And she had a stage 1A, which is incredibly lucky, incredibly early pancreatic cancer back in 2014 that was discovered in large part because of my work in surgical oncology. And then she underwent a Whipple procedure, which for her was not a big deal. Surgery, I mean, for her was incredibly not a big deal. And afterwards, her only complication had been a surgical site infection, which I had packed 3 times a day for like 6 weeks, 8 weeks, until it healed, and it had given her, you know, just regular Lovenox injections for 2 weeks after surgery. And then she was right as rain within about a month. And then it was like it had never happened.
Wow.
And then she went on to have 5 cycles of Gemzar, which was a big debate at the time over whether or not you give someone in such an early stage pancreatic cancer adjuvant chemotherapy, because this was back in 2014. And so they decided on Gemzar, and she did not at all tolerate chemo well. And we only were able to get through 5 cycles. And then she was declared, cancer free for 3.5 years. And then it was like her symptoms suddenly just reappeared. They were way worse than they had been initially. And she just very, very rapidly declined. And the concern at the time, of course, was recurrence. I mean, obviously, she has so many symptoms of recurrence. Surely she has a recurrence. And it was difficult to get providers to see that, because while they saw a patient declining at the time, they didn't see any evidence of recurrence on her imaging studies. And so we spent about, 4 months maybe with this very serious life-threatening issue of her losing weight, and not being able to maintain weight and not being able to tolerate any type of therapy.
Yeah. Another super stressful time in your life, right? And you had to be the advocate in that situation. Yeah.
Absolutely.
Yeah.
And so they actually did a total pancreatectomy and splenectomy last 2 Novembers ago. It was November of 17.
Yeah.
And she had stage 0 in situ carcinoma there. It was an IPMN, which is it's a benign tumor. It's what she had had before, but before it had harbored an actual measurable adenocarcinoma in the head of her pancreas. This time it was just stage 0, carcinoma in situ, which is, again, incredible that you can have so many symptoms from a benign tumor.
Right. Well, I can hear.
And for someone who, I mean, at the time, you got to think, if radiology cannot see it on imaging, then there's no indication for a surgery. I mean, it was this huge discussion on what to do. And if you don't see an actual cancer, there's not going to be any window of opportunity for chemotherapies or immunotherapies or even radiation. And so the only real option was to keep her a surgical candidate to have her pancreas removed.
Makes sense. How's your mom doing now?
I mean, I think she's doing incredibly well. She has, a continuous glucose monitor, and she has an insulin pump, but she maintains those things by herself. My mom is incredible in a lot of ways, but she's only, 65.
Wow.
At this point in time, and it's something she's been battling now since 2014.
Wow, incredible. And what's then again the hope for the video conferences?
Well, number one, I want to connect with other people, but 2, I've recently started leading a support group for pancreatic cancer patients at the hospital that I work at, just simply from my experience as a caregiver. Despite my tears here, I've never cried in those meetings. It's different when you come in, I suppose, in a different mindset. But I wanted to really just to be sure that the information I'm gleaning here is information that I can connect to and reproduce to some degree to other people.
Wonderful. Wonderful. Well, thank you. Thanks for sharing from the heart as well. Really, really appreciate that.
Absolutely. Thank you so much for having me.
Yeah, wonderful. Thank you. I see that Julie has joined us as well. Julie, you don't have to, but are you willing to share some of your story and what's been most difficult for you as the supporter?
Yeah, I think for me, the isolation is huge too. My husband has stage 4. It's metastasized a bit to the liver and lymph nodes. So right at the beginning, they said, no, for any surgery. It was in the pancreatic, it was in the tail. And the tumor, the first few rounds, there was a great deal of shrinkage. He was in a clinical trial, with Gemzar and Abraxane and BB1608. And it started out fine. He tolerated chemotherapy pretty well, still is. We've gone through 7 rounds. And it's just like there's no end in sight. The last CT scan didn't show any shrinkage, but it isn't growing. So I'm just kind of in a holding pattern and, of course, worried.
Yeah, yeah, naturally. And I'm hearing it ongoing. So what's most difficult? What's the most stressful part of this?
I think, thank goodness I retired a couple years ago. But it's just, I feel like I can't go anywhere in case there's an emergency. And yet there's nothing that I really need to do either. So I'm just kind of, I don't know, like my life is on hold, and his too.
Yeah, really kind of restricted in terms of your capacity to do things.
And we drive 4.5 hours for treatment every week for chemotherapy. And then we have a week off after 3. So it's just, now we have snowstorms like crazy. And we try to travel in between the snowfall and hope we don't have to cancel an appointment.
Yeah. It's like full-time work. It's a good thing you retired because you have a new full-time job in some sense.
Right,
Yeah,
right.
yeah, yeah. So that's tough. And the isolation that goes along with that, obviously. What's your hope for the seminars?
To see where other people are and to see if I can get some ideas for how to deal with this just kind of being in limbo.
Okay. Good. So thank you. Thanks, Julie, as well. I mean, it sounds like this idea of being isolated and needing kind of support is a key theme here as well. I want to just go on to some of the kind of roles that people can play within the a supporter scenario, and realize that first of all, my philosophy is that the person with the diagnosis actually really sets the tone for the supporters. They're the ones who kind of dictate what their needs are and so on. And it's always this kind of balancing act between the person with diagnosis being completely independent and you're kind of sitting there on the sidelines kind of cheering them on. And then in some relationships, you really have to be doing almost all the heavy lifting. You're actually directing the medical situations. You're having true caregiving. Sometimes comes in as well. And obviously there's a spectrum that goes through those two extremes. And the other thing is that it fluctuates, right? Sometimes you're having to do a lot of work. Maybe a post-surgery situation, you're really caregiving hard, and then or maybe there's periods of time when the person with the diagnosis is really well and they want their independence, and you're having to kind of sit back and so on. But I thought to maybe just even brainstorm some of the roles or responsibilities that people feel or see when they're in this kind of supporter scenario. Does anybody have a kind of some ideas as to how is it that you see yourself functioning?
Yep, absolutely. This is Kathleen again. So a lot of the hands-on support that I gave outside of obviously like after treatment, which in this case was surgery or chemotherapy, is cleaning, helping her clean a house. I don't live with my mom. She's married. I'm married, and we live in different homes. So being her primary caregiver, when she really needed help, it was a lot of heavy lifting. I mean, it was house cleaning, it was meals, and it wasn't just like dinner, it was breakfast, lunch, dinner, snacks. And then it was maintaining her NJ tube 4 times a day for 31 days, which is how long she had that tubing.
Yeah.
And then it was taking her to the hospital if she was having fevers after chemotherapy concern, for neutropenic fever. Taking her to the hospital in the event of pancreatitis, which happened quite often, and not due to alcohol. I mean, it was due to this tumor. I mean, all of these things, people, unless it's being touched in their lives, I feel like just are blind to it or just don't understand how much work that really means.
Yes, and you're having to gain all this expertise in a relatively short period of time. And like,
Absolutely.
if you're not going to do it, it's not going to happen. So it's like you're forced into, learning an awful lot and doing an awful lot. And that's oftentimes within the midst of a very busy life as well. So,
Right.
Absolutely. And it's,
Yeah, full-time job.
I was just going to say the validation that you provided is something that I feel like a lot of caregivers lack from, not lack of compassion from friends or family, but it tends to be a lack of validation for the amount of work that actually does really have to be done. I can't tell you how many friends were like, Kathleen, you need to slow down. You can't do all of this. And it's like, no, you don't understand. If this is not done, this person will die.
Yeah. And just thinking about all the other responsibilities in your life as well. I mean, sometimes it's the kind of sandwich generations.
Yes.
Does anybody else want to offer, like, how do you some other ideas as to what sorts of things you do as a supporter to be of greatest support?
I can relate to everything that Kathleen said about cleaning and cooking. My partner and I also don't live together. We were on the verge of making the decision to move in together when he got his diagnosis, and he owns his home and I rent. So of course there's a lot of complicated layers there. But I basically essentially live there with having my own place, but I work full time. I did take a month off shortly after diagnosis, but I went back to work and working full time. And then I come home and I cook for us, and he has kids as well from a previous relationship, and they're older and able-bodied folks who can help, but they also lead their own lives, and there's something to be said for being able to be with your sick dad, but also not have to be a primary caregiver. I've also been the caregiver for my parents previously.
Right.
So, the cooking and cleaning and caregiving, I'm also the primary researcher for looking up the treatments and statistics and clinical trials. And I come from a health science background. I have my master's in human health science. So I am very comfortable with looking at academic articles and what's working, what's the new thing, what is not worth shaking a leg at, and those kinds of things. That has been quite overwhelming. And my partner is very smart, but he sort of wants to turn a blind eye to a lot of that. So in appointments where I feel like maybe a doctor is trying to ask questions to steer him a certain way, like for example with neuropathy, he's experiencing cold sensitivity, which I think is a little bit different from neuropathy, but I could be totally wrong about that. And it's temporary, and it's not numbness and tingling, but more of like an electric shock type thing. But I felt like his doctor was trying to steer him to removing oxaliplatin really early, and I had concerns. So just like those kinds of things that I find super overwhelming that he's not really savvy to, because he's not doing a lot of the reading.
Right.
But yeah, I'm doing a lot of the research, so that's another role that I have as well.
Yeah, being the medical expert, right? And in a subsequent webcast video conference, I'm going to talk about how to get the best care from the medical system, and talking about these particular things. But you happen to be an expert already doing it all, and again, it's a very fast role. Julie, do you want to offer just a reflection on another role that you may play within that relationship?
Oh, hang on. I need to go upstairs.
Okay. Well, we can catch up with you in a moment. The other thing is that you might mute your microphone, between when we talk. Sometimes it makes it easier for everybody. So I guess the other one I think about is, how can we be an emotional support, or do you see that as your role, or is there a need to be able to be there and to listen to your loved one and be supportive emotionally of your loved one? So I'm seeing a little nod from Eve there.
Yeah, Dave is a pretty typical like blue collar guy who doesn't want to talk about his emotions, and especially with a difficult prognosis. And he was certainly felt like he was quite invincible. He was never ever really been sick, so this really has played with his emotions and his own stability. And he has 3 kids that he's very scared about leaving behind. I have done my best, and I have some mental health advocacy work under my belt. So, and I've had suicide awareness training and things. So I do try to ask questions about how are you feeling? Do you still have hope in these situations? And it's sort of flip-flops. I feel like the days after chemo when he's feeling really crappy, it's hard for him to remember how good he feels, between cycles after that sort of chemo feeling passes. And I've suggested him be the social worker that our local cancer center offers, but he's been quite resistant to that. But he does talk. He has a very good relationship with his eldest son in particular, and I feel like they share a lot more emotionally. And I think for him, he knows how much hope I have, especially given his success so far. And he was talking about wanting an extra week between chemo sessions because he feels so good, and it's hard for him to go back into chemo after that. And he said it's like having to voluntarily jump off a cliff, knowing it's gonna hurt, and just having to do it voluntarily anyway. So I do try to provide a lot of emotional support, and we are very transparent and vulnerable with each other. But I think I do feel sometimes like he's holding back to a
Yes.
degree. So.
Yeah. And it makes sense as well as to be able to have those conversations. In fact, we're going to talk about that particular issue near the end of today's video conference. But that's another role. Sorry, Julia, I had kind of cut you off somehow. Do you want to jump in and offer your insights now?
Yeah. I wish I had more of a medical background. I feel like we've just kind of thrown our souls to the treatment center where we are right now, and I'm wondering how to go about seeing what comes next. If it stops working, then where do we go from there? And just the resources to look things up. Emotionally, he's pretty open. We've been working on being honest about how he really feels, because he'd be moaning all week, and then we'd see the doctor and say, "Oh, I'm doing real well." So we're working on getting a realistic picture of where he is.
Yeah, makes sense. Good work there. Any other comments, Tim? Do you have any reflections from the first kind of round of the stories and so on?
I was struck with that story about feeling isolated at home, and through the ups and downs, and having to stay there because you can't leave in case of emergency. And I think finding some way to create your home as a retreat that is nurturing for you, whether it's the books that you're reading or watching TED Talks or whatever you can do to make an educational, to create a fulfilling life, and then to invite people into the home as well. If there are people that are willing to come, and if you can't go out, try to invite in people, because we do need to maintain as much of normal life as possible as well. And if it's a tough one when you can't leave and you start to feel a bit stir crazy.
Yeah, for certain. And it goes along with kind of a psychological isolation, which is essentially nobody else is going to be able to really understand what I'm going through.
Yeah.
I mean, I can completely empathize with, because your loved ones, they love you, they want you to be happy, but they can't understand, really what's going on internally, or your friends or your colleagues, et cetera, et cetera. And I think it is the power of support group and hopefully the video conferences and so on. So so just hats off to you all. I'm wondering if we should have a break now, unless anybody has a last reflection on just hearing the opening comments from others.
I had one comment, is that, through my personal experience with pancreatic cancer, and then, working with caregivers and patients throughout the years, it always amazes me, how strong both patients and caregivers try to be for each other. So there's always a layer of, that they want to protect their loved ones, whether they're a patient. And I've often heard patients tell me how they feel that their job of being a patient is often easier than a caregiver's job. And the caregivers often tell me the same thing, that, they feel that their, job is easier than their loved one's job of being a patient. So there's always this layer of wanting to protect each other from those raw emotions.
Yes.
It's hard to be very honest because you want to keep your loved one, safe
Yes.
or not burdened by your feelings.
Right. Right.
And
Right.
I think that's difficult. It was difficult for us to navigate as a family, but I feel, this is not my training, but I feel like that can often, be a challenge as well, that the raw honesty with each other.
Yeah, and we're going to actually address that particular issue very directly. So it's a perfect intro. So I really appreciate that. It is a major issue that we're going to do near the end of the webcast. So why don't we take 10 minutes and stretch, and do not look at a screen during that time. But thank you all for your great heart and your openness. Really, really, really appreciate this. Catch up
Good
in
start.
10 minutes. Thank you.
Yeah. Thank you, everybody.
So the second half of the podcast is really kind of focused around stress. And the fact is that stress has a profound influence on our life. And really, there's such an overlap between functioning well and maintaining a reasonable stress level. And so the teaching around this is the downsides of feeling too much stress, which is essentially we can't think as clearly, our body doesn't function, we lose energy, and we're more irritable. So we're not as happy, and we can't function as well. So it's very, very clear. And yet we shouldn't be thinking of stress as the enemy, which is a different set of teaching. But I wanted to go through the kind of levels of understanding stress and how we can use that knowledge to prime our brain to function better. So really drawing on brain science to help you to feel better and function better in the midst of a very, very difficult situation. So we're going to talk about resetting your stressometer, and then nextly, in the midst of feeling suddenly stressed and overwhelmed, like you're in the midst of a doctor's office conversation, or in the midst of dealing with a difficult person, when you're suddenly stressed and flustered and overwhelmed, what do you do in the situation? I want to share you some of the new science of stress that actually looking at stress as being helpful to you actually improves brain function. We're going to talk about, and probably more focused in a subsequent webcast, this idea that our thoughts are often causing us to feel stressed. And so we can work with those thoughts to make ourselves feel better. And then I also want to have a kind of open conversation about, keeping your life in balance. We're talking about this sense of isolation, the sense of having to focus so much of our energy on our loved one, which is appropriate, but how do we take care of ourselves? How do we find that balance such that we can actually function better? The paradox is, when you take care of yourself more, you're better able to take care of others. So how do we find that balance point as an obvious conversation piece? So the first level teaching, and I really was happy that Tim took the time and took you through a deeper kind of meditation visualization as the first part, because that has a really profound influence on resetting your stress levels, right? So we can either be kind of agitated, upset, flustered, and kind of go through life like that, or we can actually decide to kind of settle ourselves down. The same external environment out there, the same challenges are out there within your environment, but you're in a different space and better able to make good decisions, be your best self by actually practicing a little bit of relaxation exercises every day. And actually, it kind of sets up the neurocircuitry in your brain so you're able to tap into that, able to settle yourself down more quickly. And you're also more resilient. So the same external things aren't kind of triggering you into feeling flustered and scared. Instead, you have this kind of baseline wellness, baseline well of refreshing energy that you can tap into by practicing relaxation. So
I might
it's all
say a bit more there, Rob.
Go ahead. It's all a big intro just to hand it over to you, Tim. Yeah.
Okay, thank you. So yeah, what Rob is saying about, now they're calling it self-directed neuroplasticity, that if we decide that we're going to work on our stress resilience and develop that kind of emotional intelligence. And we do that every day, even if it's just 5 minutes of meditation and relaxation and really coming back home and settling, then you get better and better at that. And then when you're in the midst of a situation that's really intense, you can call upon that learning that you're developing internally. And in the world of working with PTSD, post-traumatic stress disorder and so forth, we call it self-regulation. So learning how to self-regulate, and all those kids in the schools that have ADD and so forth, including myself, practicing meditation is a way of overcoming that sort of attention deficit disorder and being always off your center. So we can actually retrain our brains to be in our center and to be calm and at peace. And then when situations happen, we have that adrenaline to call upon to deal with it intelligently and well. But when we're really burnt out because we're at a high level of stress all the time, it's really hard to manifest when it gets tough.
Can I just add, Tim, the other part of the science here is if we allow ourselves to feel stressed all the time, it actually shuts down part of our brain that allows us to experience happiness and sets up this kind of chronic stress picture of feeling both irritable and depressed.
Yeah.
So it's another reason why practicing relaxation rechanges the circuitry within your brain so you can feel happier and more confident in your decisions.
Yeah, part of the practice of mindfulness is you do that little bit of practice every day, but then throughout the day, you're also checking in on yourself. So there's that feeling of, like we talk about the stressometer. Throughout the day, maybe 20 times a day, you're reflecting back and going, where am I at right now? And just by doing that, you're creating this reflective intelligence that helps you to find your balance. It takes time over weeks and months and years, but when you do that consistently, you develop the capacity for self-regulation. And we're going to talk more about breathing after we've done the second meditation today. You want to go on to that?
Yeah.
Rob?
Yeah, actually, it's a great idea. Thank you. So, share screen. There's my PowerPoint here, and right. So, working towards life and balance. So here's, typically most of us are in this kind of dotted line. You can see that over time, we run into stressful situations and we hold on to some type of residuum of stress and anxiety. And then we settle ourselves down a little bit and we come back up again to a higher level. And essentially we get kind of trapped in this kind of feeling of agitation and irritation, trapped in high gear and not knowing that there's any different way to be. Whereas if we can practice a bit more of these techniques that we're talking about, yes, you are going to feel stressed at times. There's going to be difficult moments. The stress levels are going to go up, but you're going to be better able to bring yourself down again into a more relaxed state. And yes, stress levels again will happen. And so we have the ideal pattern on the bottom of that curve there.
Yeah, that's the learning. And if you leave it up for a minute, Rob, too. So I like to point out as well that that baseline right from early in childhood and, in doing psychotherapy and so forth, we look at even birth traumas or traumas early in childhood. And everyone has some, minimal trauma or maximal trauma. There's different kinds of traumas that people have. And all that means is the fight or flight system, the sympathetic nervous system, has gone into an intense reaction. And when that, especially people where that's happening consistently in childhood, then that basically becomes a habit. And then any situation will trigger that. And so we all have our various levels of being triggered at the level of our fight or flight sympathetic nervous system. And as Rob was saying, that fight or flight nervous system is associated with what I call the dinosaur brain, the very primitive brain that doesn't really know how to think your way out of the situation, that can't really access good judgment, a sense of getting the full perspective, a wider perspective. So with the practice of mindfulness, we can begin to initiate deliberately, on purpose, this way of finding self-regulation, settling ourselves, so we can get back into that other curve. And then you can also access your neocortex, your frontal lobe, your sense of executive functioning to make good decisions about what to do next. And then that decreases our stress in the world and our feedback. We're actually performing better because we're less stressed to begin with. And then we get less stress out of life because, so the whole thing can go in a feedback loop in a good way or in a not so good way. And it's up to us to make that difference. So that's a really important part about the whole mindfulness in medicine is it's really about taking full responsibility for the quality of one's life. And that if you practice a little bit of mindfulness and relaxation technique, you really benefit yourself tremendously. So you're taking responsibility for your well-being, 24/7.
Yeah, excellent. Yeah. And we can have a very powerful influence on our health and our
Yes.
ability. It's just true. Your brain can function better when you practice these techniques that we're about to go through.
And did you want to go into a little bit, Rob, about reframing stress?
I was going to take it one at a time, but for now I thought to do a kind of a meditation relaxation as a way to show the settling ourselves down.
So why don't we do that? If you want to, again, feel your body in the seat and tune into what they're calling introception. So if you like, you can close your eyes or just put your eyes in crescent moon gaze down low and shift your attention to the inner experience of your body and begin to assess. Just ask yourself, so am I 10% fight or flight? Is there a little bit of what I call like the vibrating chipmunk going on inside of me? Or am I really settled? And even as you sit, you can monitor that and you'll notice that it begins to change, maybe just a little bit with each breath. For many of us, however, there can also be when we open up a space in meditation, then the things that we've been sweeping under the rug, that we've been ignoring, might come up in that space and we might get more anxious. But that doesn't mean that your meditation is unsuccessful. It means that you've just got more of a challenge. So whatever occurs in the space of your meditation is your meditation. And we can begin to work with the belly breathing. So there is this diaphragmatic breathing. If you want to put one hand on your belly and one up on your chest. And notice the chest breathing is shallow chest breathing is where the lungs are doing all the work. But when you use your diaphragm like an opera singer, it pulls down on top of your lower organs below the rib cage. And that creates a vacuum that brings the air into your lungs. And then you relax naturally on the out breath. So as you breathe in, it's like blowing up a balloon in your belly. But really the diaphragm is pressing down on the lower organs. And that also massages your lower organs. And it innervates the vagal nerve, which sends a message to your brain, I'm safe. I don't need to run away from a predator. This is a good time to feel at peace and calm. So we actually have to retrain our brain to access that. And the breath is the kind of yoga. We're yoking the power of our human consciousness over that primitive brain that basically is always going to be in fight or flight if we don't step in and settle. So a little bit of pressure into the pelvis, the lower body on the in-breath, and then relax and let go as you breathe out. And as we slowly breathe out, at the end of the out-breath, we can even pause and just be still. When we do that, then nature breathes us back in. There's a quality of nature taking over, and we do a natural belly breath. So if you still have your hands on your chest and your belly, you can bring those down again. And let's just go through a brief body scan. You can begin with the feet, making contact with the floor and the earth. And just notice what you feel. As you breathe in and expand your belly, it's as if you're pushing that breath right into the feet. As you breathe out, relax and let go and give up all agendas, all everything. Simply rest. Then we can move to the ankles and the top of your feet, noticing, developing that intention and attention to pay attention to the tops of your feet, the ankles, the joints, the right and the left. And when your mind wanders and you start thinking, oh, I'm getting bored, or what am I going to do after this? You come back. You're retraining your brain to be present. Feeling into the ankle joints, tops of your feet. Take a deep breath into the belly. Relax and let go as you breathe out. And feeling from the knee down into the ankle joints, the lower legs, your calf muscles, the shins, the two bones that run down the lower legs, on the right and the left. In this way, you're minding your body, paying attention. And if there's excess tension and stress or pain or difficulty, just notice it. Just simply through that reflection, the intelligence can begin to bring change and healing. As you feel your lower legs, breathe into them like two long balloons, pushing the breath from the belly down into the legs. Relax and let go as you breathe out. And feeling the knees and the thighs, the muscles of your thighs, the biggest muscles of your body, and the long bone of your thighs, and that knee joint. Maybe it feels different on the right or the left. Just pay attention. Again, if the mind wanders, we bring it back to the experience, sensations in your knees and your thighs. Is there residual tension in your thighs, underneath, on top? Once again, breathe, expanding the belly on the in-breath, and as if you could force that breath down into your thighs and into your knees to create space and softness. Relax and let go as you breathe out. Let go of all effort. Breathing in, we can feel the pelvis, the hip joints, the bowl of your pelvis. You feel your genitals, your anus, the bum in the seat, sitting bones. Breathe into that lower part of your body. Relax and let go as you breathe out. Then notice how your spine attaches in the back to your pelvis, sacrum. We have a little curve in the low back which aligns your spine for nice posture. And feel how your rib cage comes out of your spine, and feel your belly and your solar plexus. You might just put your hand over your solar plexus. That's above your belly and below your ribs right there. And just move in a little circle there. Just notice this is a place they call the kind of animal brain. It's this plexus of many nerves that come together. Notice what you feel. And allow yourself to feel whatever it is that you do feel. Breathe into the belly and into that solar plexus. Gently relax and let go as you breathe out. You can bring your hand back down. Notice the internal experience. See if you can feel your lungs as you expand the belly, drop the diaphragm, and bring breath into the lungs. You feel the rib cage. Again, your spine and up into the shoulder blades. And how are your arms hanging from the shoulders? How much tension is in the neck and shoulders? Let's breathe into that region. Then relax and let go as you breathe out. And then feeling again this good human heart in the middle of your chest. Remembering that intention to send love to yourself, to your loved ones. Reignite that sun in your heart, sending it to your loved one. And as you send it to them, it naturally radiates out to every cell of your body. I love and accept myself just as I am, here and now in this very moment. And that radiant, loving yourself, self-compassion, touches every cell of your body and your psyche. No need to put extra pressure or judgment on yourself. I will gradually release judgment and be kind to myself in every moment of my life. And that actually helps you to be a higher achiever rather than we achieve through being hard on ourselves. We achieve through creating space through kindness. And that kindness and that love radiates out to others. And you can feel it radiating down your right arm, down your left arm, feeling it in the elbow, down your forearms, into the palms of your hands and your fingertips. When we have that intention of sending healing and love, it actually radiates out through our arms into our hands. We all have the capacity for healing hands. And lastly, let's check into your neck, your throat, your tongue. Your teeth are not clenched. Let your eyes be soft. And feel the breath in your nostrils, in your sinuses. Big breath in that goes down, pressure into the lower abdomen. Gently releasing, relax, and let go as you breathe out. In this way, we're gradually resetting our stressometer, finding a new normal that goes to a deeper place of calm and clarity of mind. letting go of troubling thoughts, being present. So just now, as we come out of this meditation, you can review what you're experiencing and then make that commitment that in the future, I can come back to this place of well-being and calm, mindful attention, connected to the earth, connected to my breath, grateful and clear-headed. Make that intention for yourself in your own way. Then we could raise our eyes and reconnect with each other. Thank you.
Thank you. That's so good. It's good in so many different ways. I'm wondering if Kathleen, Julie, Eve want to unmute yourselves just so that you can, this can be a little bit more of a popcorn type of questions. First of all, how was that meditation for folks? Are you able to relax as you're I'm seeing a nod from Eve. Kathleen,
Yeah.
are you?
I really enjoy meditations. I sometimes find it hard to carve out that time for myself. I'm definitely like in that chart, like perpetually in a stress state, I think. So I have a really hard time turning off. I have that chipmunk on a wheel all the time, but I do really enjoy meditation. I find it really effective.
Settling yourself down. It's wonderful. Thank you. Thanks for the honesty as well. Appreciate that. Kathleen or Julie, do you want to comment just on what the experience is like for you, that exercise?
I was just going to say, I second everything that Eve said. When I saw that chart, I actually took a picture of it and sent it to my husband because I think that he would agree that I'm definitely just perpetually in that survival mode type mindset. And I forget about meditation. It's something that I had certainly been very active in and that got me through during my mom's Whipple procedure. But then since that time point, I didn't feel like there was time really to meditate on this last episode. And so instead I got into running, which is, I mean, it's different. It's still healthy, but it doesn't provide the same amount of like mental space.
It is possible. It is possible to use running as a meditation, but I think you have to actually make an effort to be mindful while you run and work very much with the breath and so forth. And then when the thoughts kind of invade, you just appreciate where you are and your environment and your feet on the earth, your rhythm of running, your breath. You know, you just same once you get, and just even just a few minutes of formal meditation every day can help you to turn every activity you do into a meditation. Washing the dishes, bringing your attention back to the soap suds in your hand, you know, whatever it is, cooking dinner, whatever it is that you're doing, you can turn that into mindfulness meditation.
Wonderful. And last reflection, Julie?
Yeah, it made me realize I used to do yoga before I ran out of time and money, and I seem to be one who needs someone to lead me through it. So this was wonderful. It brought back that sense of being in the present and the breath control and settling the brain down.
Wonderful. Thank you. Well, I mean, there are online resources. You know, we do run a charity, healingandcancer.org, and there's lots of, Tim leads several meditations. We have a very gentle yoga. There's something called Qigong as well. I mean, for those who are able to stand, maybe I'll just do it from here, but it's like a standing meditation. And what you're doing, and there's 18 different movements to it, what you're doing is the same idea, is bringing your attention to the movements and your breath. And that also strengthens the muscle of bringing your attention back into the here and now. So even though we're teaching a kind of more classic meditation, you can do that through yoga, you can do that through Qigong, Tai Chi, body scan, and even running. You know, really, you know, as you're running and you're watching your thoughts chattering, you can bring your attention back to, I'm going to bring my attention to the sensations of running. Okay, so I've got you guys on unmute, which is good. because the next phase here is talking about identifying when you feel suddenly stressed and flustered, suddenly overwhelmed, just beyond yourself. And the teaching is that we all have a unique stress reaction. We all have a kind of a signature that happens to our bodies and minds. And so can you guys chirp in, when you're really stressed and frustrated, how do you physically respond? And you're in the midst of that situation and you press the pause button, what's happening physically to your body?
I feel like I'm vibrating almost. It's sort of like what I imagine a low blood sugar feeling feels like.
Yeah.
And I've been told that feeling is sort of like a low-key anxiety or panic attack.
Yes.
And I never really knew that before. Like for example, there was one day I was at work and I had just had lunch. I knew it was low blood sugar, but I got a woozy low blood sugar type of feeling coming on, and I like almost not quite hyperventilating in the way that
Yes.
hyperventilating, but
Yes.
just like, oh my God, what is happening?
Yeah.
And it came out of nowhere. There wasn't really anything that triggered it. I just, with everything that's going on, and I guess I was just tired of being at work in that moment and wished
Yes.
that I could do everything else that was on my list instead of being at work.
Yeah.
That's good. And what you're saying, to become very aware of when that state comes, and it can come from internal, just from your thoughts and from the accumulated stress in your life, just a sudden burst of adrenaline. But what you're talking about is, becoming very conscious of that quality of adrenaline. It's actually, you're getting that hormonal change. And when you know about it, then you can actually begin to ameliorate that, right? Just through awareness and then practicing this kind of thing.
Yeah.
That's really good what you said. Thank you.
Yeah, it's excellent. Julie, do you have any physical sensations that you experience when you're suddenly stressed and flustered and anxious?
Not like that. No. So I have the desire to scream and of course I don't normally. It's almost like breath stops.
Right. So
It
sometimes the
doesn't
breath
really
gets
get
stuck.
that sense.
Sometimes we hyperventilate, and sometimes the breath get kind of stuck high. We almost can't breathe. Can be the physical sensation. How about Kathleen? Do you want to offer some physical sensations?
I actually break out in like a histamine rash when I am like that physically and emotionally stressed. Like I can't hide it. Everyone's gonna see it. They know.
The big
And
flush.
yes, I actually do. Yeah.
Yeah. And I'll describe some other ones. I mean, it's the classic one is the heart beating very, very hard. It can be shortness of breath. It can be a tightness, a jaw tightening, the muscles tightening, shoulders, backbone, the sweating palms, the clenched throat, the dry mouth, the feeling like you have to go to the bathroom, the kind of just overall jitters that Eve is describing as well. So those can be the cues to our physical reaction to when we're feeling stressed. What are some of the emotional reactions? How do you feel emotionally?
You already said about, I just want to scream.
Yeah.
Right?
Exactly.
Yeah.
Anybody else?
I tend to cry, to be perfectly honest.
I was just gonna say saying me. It's usually like needing to cry or like I feel like I need to escape, like I need to go, like I need to leave the physical space that I'm in and like walk around.
Yeah.
Yeah.
And that's very interesting to note that, so the fight or flight, right? We want to flee. There's actually, your legs are programmed through the sympathetic nervous system. If you're in danger, you want to run away.
Yeah.
And sometimes the only danger is the thoughts in our heads that are scaring us, but we really want to get up and move and get out of here. So that, just to become cognizant of that really helps to know.
Yeah. And that's classic as well. Some people kind of numb out and they kind of dissociate. They feel nothing. Other people feel like they want to cry right on the spot. Other people see red, like they want to put their fist through the computer screen. There's all sorts of kind of different emotional, the feeling of anxiety, the kind of jitters can be an emotional reaction.
And there's something too in our society where people, when the people feel these jitters or fears, the intensity of feeling, often then we want to hide that. We know that we don't want to be seen in that behavior, right? And so then we suppress it, and then the whole thing kind of gets stuck.
Yeah, we don't release it. How
Yeah.
does your thinking change when you're feeling stressed? Not just what the content is, but how the thinking changes. Somebody
I
want to
end up
offer?
asking myself a lot of questions. Like my
Yes.
mind sort of races. I'm like, okay, what do I need? You know, what's this doing, and what's that doing, and what should I be doing, and what should that person be doing, and that kind
Right. Yeah.
of
So
hypervigilant.
Yes,
hypervigilant
hypervigilant.
can be repetitive, like a hamster on a wheel. You can have the same thoughts over and over. It can be very narrowed in terms of its side. And also sometimes you get very foggy, can't even think. There's
Yeah.
lots of kind of variations of that. Anybody want to add anything to that?
Brain fog is a real thing, but that often can come with like fatigue and other symptoms outside of just stress.
Yeah.
But if I know and recognize that I am stressed to the point of exhaustion, like crying as an example, something that helps me anyway is to redirect and focus on one thing, because I know I'm in a hyperacute state, and then that can force me to make a decision and move forward with something.
Smart.
Right. And that's a kind of mindful exercise to, okay, take one thing at a time, focus on that, do it well, and feel good about it, and then you can go forward. That's excellent.
Yeah.
Yeah.
And that's excellent, really. And I like these practical solutions. So the last question is, how does the content of your thinking change? So I talk about, if there was a magical computer program that could type out your thoughts for 24/7, and then the next day you read over the transcript of everything that you thought, how would you know from the words and sentences that you were having a stress reaction at that particular point in
Mumbo jumbo.
time?
I don't think it would make a lot of sense. Like, not that I become, you know, go into psychosis or anything like that, but I think if I were to read it the next day, it would be like, Eve, like, what, like multiple track mind. You just need to bring it down a little.
Yes. There's the foggy thinking comes out as a kind of jumbled.
Yeah.
Not logical.
Yeah.
I also find that after the stress reaction, the brain fog that you described is, so like after I have one of those big stress reactions, I tend to be like numb, brain
Yes.
fog,
Mhm.
like oatmeal brain is what I've been calling it to my
Yes.
I just feel like I have a bit of an oatmeal brain.
Yeah. Fatigue trying to integrate. Kathleen, you're about to say something?
Oh, I was like, I guess, mumbling in agreement about what Eve was saying. But curiously, what an interesting question. I've never actually thought about that. I consider myself a really positive person, but I wonder with that question, if there were such a transcript, if the thought content would be more negative and like
Yeah.
defeated.
Yeah,
Yeah.
maybe. I know, for instance, for myself, if I'm swearing in my mind, I know automatically I'm having a stress reaction.
Hmm.
And then, I mean, you're a very positive person, Kathleen, but sometimes when you recognize, you know, pointing towards somebody else, like that person is real, and then putting the label of them on them. So labeling somebody else can be the cue. Labeling yourself, I'm such an idiot. I can't believe I did that. I'm so stupid. You know, kind of the negative self-talk can also be the cue to say, oh, I'm in the midst of a stress reaction, or just kind of this negativity around life itself. Life should not be this way. This is awful. Kind of the labeling of something that's external in some sense.
So when we're under stress and we can regress back to earlier childish ways of thinking, or we could say the primitive brain, we get, and that's why it doesn't go anywhere. It doesn't actually resolve anything, and it just kind of spins around because it's the way that children think, and it's overgeneralized, or it's sense of all or nothing thinking, and then we get ourselves caught in all these kind of painful loops. So just a moment of settling and recognizing that I'm getting lost in my own thoughts can help you to access your neocortex, to get back into your adult human brain. And then, you know, even Freud talked about the the rationalization, what often happens is that it's the dinosaur brain that's really running the show, and it's just fight or flight. But then we come up with a reason why that I'm behaving that way, and it seems all very normal, and we tell ourselves that it's okay, but that's just what we call a rationalization. It's 80% dinosaur brain and 20% human brain.
Nice. And I wanted to actually go on to talk about a technique that we can all use in the midst of it so that we can get back into the human brain. So I'm actually going to ask folks to put on their mute buttons again, because I think if we're not muted, we degrade the quality of the sound. So the sooner that you can recognize, I've got myself flustered, upset, stressed, the easier it is to actually settle yourself down, to kind of get back into the wise and compassionate part of your brain. And as a symbol, this is your wise and compassionate part of your brain. And when you're stressed, you're like, ah. And what you want to do is bring your frontal lobe online again. So that's the idea. So the moment that you recognize, I'm upset, you don't have to typically act. You don't have to snatch the child from underneath the car. You can actually take a moment to settle yourself and decide how you want to respond to the stressful situation. So almost always we've got time to do this. So the first thing is to let go of the thoughts that are driving the whole stress reaction. You're going to tap into that intelligence afterwards. You're going to use your information in your ego mind and all the rest of it to make a good decision afterwards. But for now, when you recognize the stress reaction, first thing is to become very curious of the physical sensations in your body. So you can actually do this technique as I'm talking to you now. Like Tim took you through the kind of body scan. Right now, become very, very curious. What does it feel like to be in your body? So now you've gone into a different part of your brain called introspection. Next is to take 4 slow of the relaxation breaths. So it's lower abdominal breathing, and you can do a longer, slower, smooth out breath. And become very curious of the sensations of breathing. Like, what does it feel like right now to slow, smooth in-breath and longer, slower, smoother out-breath? And as Tim was explaining, that's sending a signal from your vagus nerve up to your brain to say, I'm safe, I'm okay, I can handle this. And then the last part of it is that once you're now back into your wise, compassionate brain, you can actually talk to yourself using that kind of wisdom. Look, you can say to yourself, I can handle this. Let's take one step at a time. Or as Kathleen says, well, let's just do one thing now that can get me back into focusing on what's positive here, what I can do in the situation. So then you're using the wise and compassionate part of your brain to talk to yourself, to settle yourself down and to make a good decision in the situation. So just as a quick repeat, when you recognize stressed, become very curious. Let go of this chattering, worrisome thought. Feel the sensations within your body. 4 slow breaths, and then talk to yourself and make good decisions at that point. Tim, do you want to add?
Sure, thank you, Rob. So there's an acronym that people use, STOP. It's very simple. And the first S stands for stop. And especially as Rob's saying, you want to stop torturing yourself with thoughts that are making you feel worse. And then it's take a breath. So you stop whatever you're doing that's getting you going, and then you take a breath, or as he said, 4, and then it's belly breath is more powerful. Really relax and long out breath. Then it's observe. And we're finding with the PTSD work and so forth that using your senses and you're just extending, like Rob says, your curiosity about this moment. You observe your current state. And most of the time when we're, as human beings in Canada or US, when we're under stress, it's been caused by our internal stimuli, and actually our external situation is not really too bad. So when we actually pay attention to that I'm safe, I'm in a good environment, and you look around and find something beautiful, find something that's calming, you observe, and then you can proceed. Then you can. So STOP is also another way to think of it. Right, you're muted, Rob.
That's in the moment. That's an in the moment scenario, right? So in the midst of the doctor's visit, or someone is upset, or you're having to, present something, you can kind of settle yourself down. You're not going to get back into like perfectly calm, but you are going to settle down your physiology more. You'll be able to more access your frontal lobe and to make those good decisions. So that's this kind of a second level. The third level teaching is to see that stress is not our enemy. For the most part, when people are feeling stressed and flustered, we hear all this, you shouldn't be that way. It's bad for you. It's bad for your health. You can't think as well. And we add an extra level of stress on ourselves when we say, oh, this is bad. I shouldn't be like this. This is not helping me. And you're stressed on your stressed, essentially. And the trick here is to recognize that stress is a normal part of life. It enervates us. It's our life energy. And if we can actually use that life energy to help us think more clearly, and even talking yourself into that changes how your brain functions. Mm-hmm. So instead of saying, oh, this is really, really awful. Life shouldn't be like this. I shouldn't be like, you say, okay, I'm feeling stressed now, but I'm going to use the energy of the stress reaction to focus my mind. I'm going to use the energy to make a good decision or go into the situation. And there's lots of really cool science of how people perform better when they simply tell themselves that this stress is helping me as opposed to this stress is harming me. So the next time you have to give that presentation, instead of trying to calm yourself down, you can say something like, I'm excited by this presentation. Or the next time you're dealing with a difficult medical situation, they say, well, this will give me energy to make the right decision. Just changes the brain's ability to think and to remember and to perform during stress. And that's the very, very short version of the new science of stress.
Yeah, and that's basically the I can do it. There's a sense of empowerment and a sense of taking that energy and saying yes to your experience. And it even reminds me of the book that Viktor Frankl wrote about his time in the concentration camps in Nazi Germany. It's called Man's Search for Meaning. And, there's that deep meaning. And what he says is that there's those people who wandered through the camps, caring for others and giving their last piece of bread. And those people, just their very existence points to the fact that we have this inner freedom, regardless of what kind of stressful, intense situation we're in, we can choose our inner reaction. So that kind of depth of kind of profound transcendental approach is that as human beings, we have the capacity to choose our response rather than to be shaped by the stressors in our environment.
Well said. And it really feeds into really the fourth level of stress reduction and reframing, which we're really not going to have time to do today, which is reframing our difficult thoughts. So essentially, it's the understanding that oftentimes it's the thoughts that give us the emotional reaction. If you think to yourself, I'm no good, I'm useless, I'm worthless, it leads to depression, for instance. And so in the same way, this situation shouldn't be this way and I'm feeling a lot of stress. If you can reframe that to say, well, this is the truth, this is my starting point, and I'm going to try to find some meaning and bring my best spirit and be a positive influence in the situation. If you can do that deeper work, the deeper psychological work, then your stress reactions will actually decrease with time. So it's the deeper work that takes time to go through, but there is a technique called cognitive therapy, which you can tap into, that really will have a profound influence on your life in other ways.
And we're hoping to do that in a future podcast.
Yeah, we're hoping to actually take you through the technique of,
Yeah.
going to those thoughts, those automated distressing thoughts that we often don't question. If we can actually look at them, see what they're trying to tell us, and reframe using both our wisdom and our compassion, it can be a very positive way to influence how you look at the world and how you function in the world then as well. So,
Yeah. And this is all part of the mindfulness approach to self-empowerment, is the more we become aware that I'm creating my life, then I can choose how to do that. At the level of my thoughts, at the level of my body, the level of my stress reaction, I can empower myself to do it in a way that's more effective.
yeah. And interestingly, it's the self-compassionate approach is actually the most effective way to make a change.
Mm-hmm.
Right? So if you see that, oh, I'm screwing up in this particular way, instead of being harsh on yourself and trying to guilt yourself into changing, it's like being kind to yourself first, and then also using your rational brain, and then being positive. I can make a difference. I can grow from this. You can always say from any situation, I can learn from this.
Mm-hmm.
Right? There's always that opportunity of reframing from that particular perspective. Okay, so that touches, there's 4 levels of kind of stress teaching there that we're talking about. And lastly, I kind of want to open it up into, I mean, you guys, the 3 of you are describing, very busy lives. Like you're having to do an awful lot right now. What do you do to keep your life in balance? Or what are some of the self-care activities that nurture your soul, that allow you to be, a better person, better mate, better caregiver? Does anybody want to unmute and offer some of their? Eve, go ahead.
I recently started seeing my massage therapist again. I find body therapy, because I hold a lot of stress in my shoulders and neck. I tried to savor. I really like weekend mornings. Those are kind of sacred in my house. We have coffee and breakfast, me and my partner together, and it's just sort of a quiet time that is reliable. There's also, I do have an e-counselor, so I work through HASU, HASU e-counseling. I find that more accessible than going physically to a therapist, so I could just message her whenever I want. And I've been seeing her for almost a year now, because my dad had also passed away in November 2017. Sometimes I honestly think she must think I'm making it up, because like you can't, like it's just it's pretty wild. But yeah, so having a good counselor support group like this, I'm really glad to have found the support group.
Yeah. Well,
yeah, nourishing, trying to move my body.
Wonderful. I mean, I love the full description, because you're doing it all. There's body stuff there, there's social stuff there, but I really like this. Seeing a counselor, being part of a support group is very, very powerful. So hats off to you. Really wonderful.
I also want to add, I acknowledged for myself that I did need to use medication and antidepressant, just a small. I take like 10 milligrams of Cipralex has been immensely helpful, because after my dad, he died really unexpectedly, and then less than a year later, my partner got this diagnosis, and I was just like, okay, I gotta tap out. Like I need some
Yes.
medical help here. So just for anybody else that is struggling, I think it's really
Yes.
important to
Yes.
admit when you might need some medicine.
Yes. Good for you. Like really, that is self-compassion. I'm going to do what it takes for me to balance myself off. And then I can do this other work, and hopefully I can wean myself off of medication later. But really, it just makes my heart smile to know that you're really taking care of yourself, really in all realms. So that's wonderful. Kathleen or Julie, do you want to offer, like, how in the midst of the incredible busyness, where is the self-care activities? Where's the balancing points for you?
For me, it was like if we were talking about active care with my mom at different time points during her or throughout her diagnosis and treatment. It started off with, I'm going to do like gentle yoga with her. That was something that we did together after she recovered from her Whipple. And that was a way to kind of kill two birds with one stone, to some degree. And then I continued on just by myself with some Bikram yoga. And I thought that that was just extremely helpful to be like, I know for this set amount of time on a certain day that this is what I'm going to do to process through these thoughts and feelings. And then with this last episode that had been just so time consuming and emotionally draining and financially draining on top of like life, which is already packed with so much, running for me really helped because that was going to exhaust me to the point where I had to sleep. So I worked during the week, like during normal hours, typically business banker hours, if you want to call them that. And then on the weekends, which is how you've caught me today, is I've worked night shifts. And so not only do I typically have like a swing schedule, but if I don't sleep, then you notice tears. I mean, I'm going to cry because it's just, I'm tired.
Yeah.
So sleep for me is a big deal. I've always had insomnia. It's never been treated. It's kind of like a hereditary thing with me and my dad. And so I already know I'm going to be much better if I can get some sleep.
Yes. Yes. Self-care again as well, right? You know what your body needs. And I really like the fact there's exercise part of it. It changes our brain function. And lastly, I just want to really reflect back to you that having some reflection time, some integration time, almost like built into your week, that kind of walk in the woods to say, oh, what's really happening here? What's actually going on? And the brain is in the mind, it has its natural way of kind of healing and to integrate itself. So that's it's just wonderful. You're describing lots of different ways that you're taking care of yourself. Thank you. Julie, do you want to offer something that you do to help yourself?
Yeah, I do a lot of writing. Sometimes just having it on the page helps get it out of me. Or also walks through, we have a wooded path not too far. So the dog and I will go sometimes for very long walks in the woods and motion. In the summer, I'm out on my bike most days if I can along the river. So I've got I really need to be outside with trees and green.
Yeah.
And so that helps.
Yeah, that's wonderful. I mean, we are wired from a kind of physiological perspective just to be outside, to see the nature, the trees or even the sky. And, the studies are quite clear that that does actually produce like a relaxation technique. So wonderful. And just lastly, it's so wonderful. The three of you just covered so much of the space. The writing, that is also an integrating function, right? So you're reflecting on your day and you're writing in the evening. Very, very powerful self-care mechanism. So wonderful. Tim, do you want to offer your reflections?
It sounds really great. I think we've got people that are very self-aware, and I'm impressed with people knowing themselves and what they need, because each person is unique and we need what we need. We don't need what maybe our friends are telling us we should do. So really that listening to yourself and seeking your own path is really great.
Yeah, wonderful. And to finish it off, because it would be nice to finish in the next 15 minutes or so, but we'll see how it goes. Stephanie brought up this critical idea of communication, and Tim and I have seen it over and over in the retreats, this idea of kind of putting on a brave face because we're trying to protect our loved one. And I say it comes from a good place, a good heart. There's a good intention there to say, why I can't kind of break down. I can't be emotional because if that happens, that will add an extra burden to my loved one. And, the fact is it simply doesn't work is the truth. And maybe I'll offer, the quick story. I was up on the ward and I was sitting down with a woman. She had a more advanced cancer and we were having a conversation. And she said to me, I don't want you to tell my husband that my cancer is really advanced like this. And I'm like, well, okay. It's her right that I don't share information about her with other people. But I always feel uncomfortable when somebody says that. And then I'm walking down the hallway and I get pulled into the kind of side closet by the husband. The husband says, I don't want you to tell my wife she's got an advanced cancer because she can't cope with it. So these guys kind of completely, disconnected in terms of the truth of it. And you know, so we actually do a cognitive reframing exercise looking at, you know, I have to be the strong one. I can't let my husband or wife know how I'm really feeling. If I fall apart, that will make him or her feel worse. And we kind of go through that step by step in terms of the kind of cognitive distortions. Like I have to be the strong one all the time. You know, if I do this, this is what's going to happen, which is the fortune teller error and so on. And also just the fact is, when you kind of withdraw and try to hold back, it sets a culture within the relationship which says, I don't want to talk about this difficult stuff. And so the partner gets that message, okay, well, you don't want to talk about it, then I shouldn't talk about it. And you're kind of creating these silos of, you know, non-communication. And the fact is, we can't hide what we're feeling from our partner. It's like they can read right through us. So ultimately, it doesn't work, is really how it goes. And although it's scary, what we are trying to encourage people, like Stephanie said, is that open and authentic communication. I'll stop there. Tim, do you want to you know, make the first reflections on that before we go into particular kind of ways that we can do this?
Well, yeah, Rob, I think that you covered a lot there, and that it's, I think of being at a retreat where I was suddenly in the group with all the husbands of wives with cancer, and to a T, they all had the same approach. I'm not going to break down. You know, and there was such a realization when they all realized they were all doing the same thing. And it almost through that, they recognized maybe this isn't working, you know, and then we had a good chat about that. So I do think that we can support each other, and the vulnerability is really our strength and our wisdom. And when we can open ourselves to that and feel okay about being human and having a reaction, then we're more open and empathetic to others. Because really, our ability to be compassionate and loving to others really starts with ourselves. To the degree that we can give ourself space to feel what we feel and be honest about that, then we're actually going to do that for the other in a more effective way as well. So it's all a mutual kind of benefit to be open and honest and to dig deeper with oneself. Yeah.
The tricky part for me is, as the supporter, I often think the supporter has to take their cues from the person who has the cancer diagnosis, because really, in some sense, it's their journey. They get to kind of choose how they want to live their life. So there's this kind of tension to say, okay, well, I'm going to listen and respect you. At the same time, we have needs, and that we can actually set the culture within the relationship. So, you know, for instance, you can say, I mean, it may not be with the person that you're taking care, or the, you know, person with the cancer diagnosis, but there should be at least one person in your life where you can go to them and say, I don't want you to correct me or try to give me advice, or all I want to do from you is for you just to listen to me. I just want to be able to say what I feel and go there. And so, to what degree can you do that with your loved one with the pancreatic cancer diagnosis is a question for you. But I think if we could, explain what we need, it often is the basis of good communication. I need to tell you how I'm feeling. Please just listen to me. You don't have to provide me advice.
And you could even invite our loved one who's suffering with pancreatic cancer to do the same, to give them the opportunity to create that, if they're open to it, but to create that same opportunity, to be proactive and create that environment where that kind of communication is the culture that we want to create. And I think as human beings at this stage of our development, we have to be deliberate about that, because often it slips by and it won't happen if we don't take the time to say, let's sit down and really listen to each other.
The time and courage.
Yeah.
Because it takes courage. It's unknown. It's uncomfortable. So, but I also know we got 3 wise women on the video conference. I'm wondering if if somebody wants to share, this idea of opening up that conversation and being vulnerable. I think Eve had talked about it earlier on in her discussion.
Yeah, I have no issue being vulnerable. With my partner or with anybody, I'm quite transparent. Largely what you see is what you get. I think that he is a little bit less comfortable with being vulnerable, being sort of a blue collar, like typical, like stereotypical dude, like not really wanting to share his feelings a lot of the time. But I feel like I get those glimpses for sure of vulnerability and, being what his fears are largely with his kids, not being around for his kids and grandkids and those kinds of things. So I've gotten glimpses into what his concerns and fears are. But yeah, I think it's more difficult for him to talk about those things than it is for me. But yeah, and I know that he knows when we're talking about things like that, I'm not expecting him to fix things. He's a very good listener. Lots of experience in that sense. So he knows that, just hearing each other. I have a harder time, I think, because I'm a fixer. I'm a doer. Like, I'm like, okay, if you're feeling happy, what can we do? Like, have you taken, your meds? Have you had enough to drink? Have you had something to eat? And sometimes he's like, okay, I know what I need to do sometimes, but sometimes I'm just feeling crappy and I just have to tell you that I'm feeling crappy. So that's something that I could work on for sure.
Yeah. Wow.
Good one.
Beautiful. Julie or Kathleen?
I'm just going to echo some of what Eve said, in that I'm also a fixer, and I consider the relationship with my mom to be a partnership in a lot of ways, especially regarding her cancer diagnosis, which is kind of strange because then family dynamics are a little odd if I'm the primary caregiver and I also don't live in the house, and then my dad, who is my biological father, and he's of course married to my mom, and they're in the same house, and there's disagreements on his way of coping or not at all, in my opinion. I didn't find him to be exceptionally helpful with anything or exuding any type of emotion other than just a lot of like going into himself. So he certainly had a very difficult time, or has the whole time, which put extra burden, I feel like, on me to some degree to shield her from that.
Right.
Even though they were living together and still are obviously living together. They're still married. But it was just strange to see the difference in terms of their relationship versus her and my relationship. And of course, my thing is, okay, I'm going to, we're going to get through this. You want to live, we're going to make it happen. And I'm going to do everything I can to help you do that. And there were plenty of times where she was probably pushed to the point where she was like, Kathleen, I know what to do. You're going to have to like take a second to let me just do this, or I don't want to do this today, or I don't want you to give me that medicine right now. And it was like, okay, that's fine. I completely understand. And the more compassionate I was about it, instead of like pushing it and pushing it and pushing it, the better off the relationship ended up being, where it wasn't like, I feel like I'm forcing you to do something because it's best for you.
Right.
It was better to be like, okay, maybe not right now, maybe later.
Yeah.
And she'd be like, okay, great, no problem.
Yeah. I mean, I like this idea because you're like, as the tension is coming up or as the issue is coming up, you can kind of verbalize that and say, okay, I see your perspective. I see that you don't want to use that. I respect that. Right. So it is opening up the communication, even when it's like, we disagree here, is opening up the communication.
Yeah, I figure she's the patient, and if she does not want to do something, I'm not going to be able to, I don't know, force her to do it or to keep her happy. I mean, it's a give and take in both regards. And, back to the point of who's carrying stress or how it's being managed, very interestingly, I went with her because I go with her to all her appointments, and I went with her to a new primary care appointment. And they were doing just regular surveys, and the primary care doctor asked her how her stress level was, and she smiled and she said, I don't have any stress. And I was beside of her and my jaw fell open, and I think I started crying, and I was like, what do you mean you don't have any stress? And she was like, well, you take care of it for me. And I was like, oh, that's so true.
Oh my gosh, Kathleen, I relate to you so much. feel all of that.
Yeah. And so it was really surprising because it was just like, oh my God, I think that's wonderful that you weren't feeling that. That means I'm being successful. But at the same time, like I'm carrying it around then very obviously.
Right.
So,
Right.
Yeah.
Good insight.
yeah.
And hard sometimes to let that other person do what they want to do, even though you see who's different. So.
Oh God, yeah. So she had the NJ tube and she did not like it. She resented having it in. She didn't have any like sedative medication prior to them putting in the bridle, and so it was a painful experience. She was embarrassed to have it. She didn't want to manage it. um, her insurance only covered like an IV pole, and so I had to buy her like a book bag so she could be mobile.
Right. Yeah.
um,
Wow.
yeah, and so then I maintained all the feedings then as well, and then you had like this special protein injection once a day, and she hated it, and it made her feel nauseous. And so it was this, just food in general. It was such a battle to keep her a surgical candidate.
Yeah. Incredible how much work you did there as well. So thank you.
And I'm aware of that, how difficult it is with your dad too. And that, and that's a real stress on you as well, and how to gradually include him in one way or another. Or, he sounds like he's really drifting away.
I can't get him to talk about his feelings about it. I think that he just shut off initially when he heard cancer diagnosis back in 2014. And he's still a partner to her, obviously, but it's just our relationship has certainly, for other reasons as well, just completely been obliterated. And it's extremely difficult because it's like, well, I'm going to cook you food and drop it off at your house.
Right. Yeah.
And then he's going to say, well, I'm not going to eat any of it.
Right.
So it's like, okay.
Ouch. Yeah.
Yeah.
Hard. Yeah.
Yeah. Thank you, though. I really appreciate that kind of honesty through that.
Mm-hmm.
Julie, do you any last reflections on this topic of opening up that difficult conversation and sharing how you're actually feeling with your partner?
Yeah, some days we do a better job than others. Lately, we've been just sort of checking in at the end of the day and kind of going through the list to see, okay, where are you really on this? And that seems to be helping.
I like that ritual, right? Is the kind of expectation of we are going to talk about this, and even putting on, at the end of that list of like, how are you doing emotionally? Like, how are you really doing on the inside? And then just listening and reflecting back is, I think, there's a huge therapy in just listening. That's what I learned through the kind of palliative care world. I don't have to correct things. I don't have to make recommendations, but simply listening, hearing that person's truth, understanding them, and enjoying the positive moments and empathizing with the difficult moments is an incredible therapy in and of itself.
Yeah.
Tim, I'm wondering if we should finish off with a kind of brief meditation. This was, I'm actually really heartened and really grateful for having experienced this last couple hours with the wonderful trio of you. And we're hoping we'll see you again in a month's time too. We'll have a few more people hopefully advertise further and wider. And again, thank you. Tim, do you want to take over from here?
So if you've noticed someone that you want to connect with, we'll try to set that up so that people can reach out to each other.
Yeah, we'll have more people hopefully next time to connect.
Yeah. So just as a closing, we can reconnect with that centered quality within ourselves. Come back to our feeling of the body on the earth. And enjoying our breath and recognizing how powerful breath is as a way to help us cope with the stress in life. And we can take a moment and just review kind of the benefit that we've received or that we've given in this webcast. Perhaps with a smile of gratitude, we can feel the goodness of all of our intentions, as if breathing it into our heart with a smile, then we could have a feeling of giving that out to those who weren't here, to that outer circle, and beyond that to circles expanding, with the intention that everyone may benefit from the kind of goodness and insight and good intentions that we all have. We send that out to everyone everywhere. Excellent, thank you. So we can close with that.
Yeah, thanks, Tim. That was wonderful. And
Well
huge
done.
thanks, Kathleen. It was wonderful to meet you, and Julie as well. Thanks for sharing from your heart. Just really,
Yeah, really appreciate meeting you.
Well, thank you both. It's been wonderful.
thank
Good.
you.
Yes, thank you. This was just what I needed today.
Oh, good, good, good. Well, hope to see you in a month. And a huge thanks to Craig's Cause and Stephanie and the entire gang for setting this up. We're going to share it as a video. We'll get permission from those who attended if they want to include it. If not, if they don't, then we'll cut them out and just add the teaching part of it. So blessings to you all.